Hey, good evening, everybody. It's March 22nd, 2020, and it is 8:40 p.m. Broadcasting from my living room here, and you can see that my hair is quite long tonight, and I think this is the main fear about social distancing. One of the main fears is that you're not going to get out and do your normal routine, and I don't think anybody wants to walk around with a head of hair like that unless you're Howard Stern, who I like, by the way. Social distancing and how important it really is. And there's no jokes about COVID-19, but I do want to make people remember this because it is never been more important than to distance yourselves and to try and stay in as much as possible. You know, we've seen after this week a whole host of patients, and like I said in one of the original videos, there's no age or nobody is immune. It's absolutely true. And we are seeing this in 40-year-olds and above. And some of the more severe cases are happening in the early 40s and into the 50s, and it's being reported all over the world. Yes, the elderly and the ones with comorbid conditions are still the ones at the highest mortality risk, but nonetheless, people of all ages are getting COVID-19. One of the theories that came up was that male patients may have more ACE2 receptor sites in their type 2 pneumocytes in the lungs, and the COVID virus activates that receptor, and there has been talk in regards to staying away from ACE inhibitors for that reason at this point in time. But social distancing is important not only outside of the house, but also somewhat inside the house if you have a patient who has symptoms and is being ruled out for COVID-19, or maybe had a mild case and did not need to be hospitalized. You know, how do you social distance inside the house? But I drove home today. It's Sunday, and I stopped off at one deli type place, and it was packed in there, and it was concerning to me. And seeing the cases that I see, I don't know if the population fully understands how contagious this thing can be. They're talking contagion factor of one person who's infecting about 2 up to 3 patients or people, and that's a high number, and that means that you're going to have a pandemic or an exponential, at least exponential growth of the virus. So again, if one person can infect 2.5 to 2.9 people, which is what the number was, that will lead to an increasing number of diagnoses and patients getting the disease. When it's 1-to-1, you have a sort of steady plateau, and when it's less than one person infecting one person, then you see it disappear, and it will evaporate. And that's the goal, is to get that number down, to get the number from one person infecting 2 to 3 down to one person infecting less than 1, and that's what's required to get this pandemic to stop. So we have to do our part from the public to isolate ourselves. Even if you don't have a symptom, it's important to understand there's at least one study that suggests that even an asymptomatic carrier can in fact transmit this virus. And even though the incubation time was thought to be under 2 weeks, there are some studies that are suggesting that it could be 20 plus days. And how long the virus actually lives on a surface is debatable. We spoke of that before. It's still being studied, but it could be up to several days. And one study I saw suggested up to 4 days on surface or hard surface tops, and one maybe even more than that, up to 8 or so. So again, this is a contagious virus. It is one where one person is infecting almost 3 people, and we got to get that number under 1. So social distancing has never been more important. If you don't need to go out to the store, don't go out. If you have enough stuff at home, that's great. Don't go out with 2 people to the store. Just have one person go. There's no reason to have 2, because you don't need that much stuff immediately. So I think that's another important point. If you have somebody who's sick at home or is being ruled out, you have to social distance inside the house. There's no recommendation to wear masks. I don't believe. I haven't read any, at least, unless somebody has something they can cite for that. But we don't want to use up the supplies of masks, but maybe it wouldn't be a bad idea. I just don't want to suggest it without data. But that's something to think about. And in another segment, I'd like to talk about obstructive sleep apnea and CPAP machines and BIPAP machines. Right now in hospital settings, we're trying to avoid BiPAPs, although one study or one look did suggest that maybe it is worth a consideration. The main concern is that it could be blowing particulate out, and this is a large droplet virus, at least it's thought to be, and there are some looking at it as maybe even a smaller droplet transmission. So we will cover sleep apnea and CPAPs and BiPAPs for now. What I would suggest in the patient at home, if you have obstructive sleep apnea and you utilize your CPAP or BiPAP device or whatever type of delivery you have, that for now you should continue using it as advised by your clinician. Again, if you have symptoms, then you're going to be isolating yourself even within the house, excuse me, from other people there. And so you should still continue to use your positive pressure device to treat your sleep apnea. But again, we'll cover sleep apnea more detailed, what it is, difference between obstructive and central sleep apnea, and maybe just a general topic on sleep apnea, even as not related to COVID-19, or at least get into both. So please be safe. Please stay in if you can. Go out for necessity, for food basically. I know the drive-thrus are open. They seem to be doing a really good job with that. There's still going to be transmission that occurs, but it should be limited. Obviously, we have to eat and drink, so just be careful. And again, if you do need to go out, if you don't need to go with more than one person, then don't. Stay 6 feet away from each other, even inside the house. Again, with somebody with symptoms, it's important. Thank you and have a great night, and we'll see you tomorrow. Be well.